recording.
Hello, my name is Katie Fitzpatrick, and I work with my partners Santi, Austin, and Mark in order to come up with analysis for Stormontville Health data for the Data Fest 2026. So let's begin. We first looked at and had a total of 7 data sets to go over, which concluded over 7.6 million patient encounters, clinical diagnosis, demographics, location, and social determinants of health. These all played an important factor as we evaluated the data, and we were able to come up with some research questions which helped supported our interest. With that being said, we cleaned our data in order to make it all similar and have on the same page. And we were able to conclude 3 research questions. First one we started off was, are rural Stormontville clinics growing or declining? This being said, we were able to find out if any of the patients were transferring between different hospitals. So this led us to our second question. Is Topeka absorbing patients from the surrounding cities as smaller cities decline? Topeka, we found, was the leading hospital in the data set, and so this is something that we wanted to take note of and look into. Our last question, and this is what kind of concluded our whole analysis, is what specific area of needs are going unmet, and where is this the biggest opportunity for growth? Are we able to find out that smaller clinics are able to help improve their research and their patients in order for them to keep their clients at one hospital? So with that being said, let's get started with our analysis.
So we wanted to focus on 4 main locations, which are Topeka, Manhattan, Junction City, and Emporia. It's important to note that Topeka is the main hospital in this network. Stormont Health is serving Northeast Kansas, which is why the major city in Kansas, Wichita, is not included in this chart. As said before, since Topeka is the main hospital, it sees 307,000 total encounters from 2022 to 2026, followed by Manhattan, Junction City, and Emporia.
So let's dive into a comparison of Manhattan, Junction City, and Emporia without including Topeka, since it's an outlier. So we see that when Manhattan Clinic opened in 2023, it spiked in volume of encounters, right? And now has been the leading one in the top, those top 3 cities, right? We see that second comes Junction City, that is being growing steady, and then Emporia, which has been declining by a little bit. So in this graph, we looked at the essential specialties used. So whether patients were using lab, radiology, primary care, and care management. So let's move on to the next one. So by looking at this, we also wanted to see the average growth between these cities. So we see that Manhattan, Junction City, and Topeka have been all growing. Manhattan by a lot, Junction City as well, and Topeka has been growing steadily as it's the main hospital hub. But we see here that Emporia has been declining 20.4%. So here's something that we wanted to look deeper into. So now that you know that Emporia has been declining, let's see the healthcare system self-sufficiency. Topeka versus other cities. Topeka dominates with 93.8% of patients staying locally. So they don't have to travel because they have the most specialties. They don't need to visit other clinics. But we see that Emporia, Junction City, and Manhattan, they all have to travel, and around 39% of the times. Emporia leads the way by 43.8% of the patients having to travel to other cities to meet their healthcare needs. So let's dive deeper into this.
So yes, we wanted to see where patients were migrating to. And in this case, Emporia, a lot of the patients were migrating to Topeka. In this case, 40,000 patients. We can also see that there's other patients from other clinics like Junction City and Manhattan migrating to Junction City or Manhattan and Topeka. However, they're not migrating that much to Emporia. So this suggests that Emporia is losing patients to Topeka and is not gaining that many patients from other clinics. Now, we wanted to see why there were so many patients going to Topeka. One thing we wanted to look at was the departments that Topeka had to offer. So looking at all the hubs, Manhattan, Junction City, and Emporia, there are a lot of encounters being seen in care management, radiology, and primary care, and in lab, which makes up 47.5% of the total visits at Topeka. Now with this, we wanted to see more.
With all this information we have so far, let's dive into the slide that talks about Emporia patients seeking care in Topeka, mostly focusing on the top 5 specialties and the affected age groups. In the left graph, the one that talks about specialties answers the question, where are they going? This chart shows which medical departments are most frequently visited when Emporia patients leave their home cities. Topeka is the primary destination. The overwhelming majority of the patients traveling for care go to Topeka across all the top 5 specialties. With care management being our top specialty, this has about 7,074 visits and is the most sought out service in Topeka. Other specialties include primary care, endocrinology, cardiology, radiology, also show significant volume in Topeka. On the right graph, we are focusing on the age group, answering the question, who is traveling? This chart breaks down the same group of patients by their age bands to see which demographic is the most affected. We identified seniors being in the age bracket of 65 years plus as the largest age group. There are about 13,068 visits to Topeka by the patients in this bracket. This suggests that the elderly population in Emporia is the most reliant on out-of-town specialized care. This correlates, the age information has a correlation. There is a clear trend. As age increases, the number of patients seeking care in Topeka increases as well. Lastly, just like the specialty data, the age-based data confirms that Topeka is the preferred destination. In our conclusive slide, we talk about what the data tells us. Emporia is a declining market by about negative 20.4%. 43.8% of Emporia patients have to travel to other locations. Preventative and chronic condition is the main reason of travel, not just emergencies. Manhattan shows that opening a clinic immediately captures demand, and Topeka is used for ongoing chronic disease management. Our recommendations are: build a chronic care clinic in Emporia, which will focus on care management, primary care, radiology, and lab. Prioritize the 65-year plus olds, which are identified as chronic care patients, as well as model the expansion of Manhattan's financial success. Thank you.